As Australian surgeons and their Timorese counterparts screen and operate on Timorese children with colorectal conditions in Dili and Maliana districts this week, RTTL World News reporter Vicky Madera spoke with Jessica Redwood from Children First Foundation about the impact the visiting doctors have on the children's lives and the challenges facing Timorese healthcare system.
Your team is currently on the ground screening and operating on Timorese children with colorectal conditions. What is the primary goal of this visit and how many children are you hoping to treat?
So Children First Foundation works to provide life-changing and life-saving surgery to children from developing countries like Timor. So in this trip we have two goals. First of all is to provide paediatric surgery to children in need. So paediatric surgery is kids who have needs in this bit of the body. So it can be colorectal, it can be malformations, it can be a whole range of different issues in that part of the body. So that's our primary goal, but we're very much also here to support the capacity building of our local colleagues. You have incredible surgeons here in Timor, but unfortunately there are no paediatric surgeons, which means that children go without, and it means that they can live with ongoing pain, ongoing preventable disability, or even, most tragically of all, sometimes they don't survive.
For young patients who have spent their whole lives with a colostomy, how will this operation change their everyday lives?
For the kids who are here for colostomy closures, they will be able to have their colostomies closed. They will live with bottoms for the very first time, which means that they won't have to deal with the discomfort of having their poo coming out of their side. Sometimes that can also be embarrassing. It can be a lot for families to deal with. And so once that's closed, they will be like every other kid, being able to go to school, being able to have fun, being able to pursue their hopes and dreams, which is exactly why we're here.
This mission brings together Children First Foundation, Queensland Children's Hospital, the Royal Australasian College of Surgeons, and the Guido Valadares National Hospital. How crucial is this international partnership?
It is absolutely crucial. You know, a stool with one leg falls over. So whenever you're doing something when it comes to sustainability, well, it's our values that we do it alongside others. So Children First is obviously here for children and the provision of safe surgery. Our partners from Queensland Children's Hospital provide the surgeons and the nurses to come and be able to support that, and the anaesthetists, of course. And then the College of Surgeons has been involved in Timor for a long time, providing that quality assurance. And of course, none of this could happen if it wasn't for our incredible partners here at the hospital. We're only really here because they asked for us to come, and we're incredibly privileged to be able to walk beside them as they reach their goals.
What challenges does Timor-Leste's healthcare system face in delivering pediatric surgical care?
It's really coming back to picturing that mum holding her baby, acknowledging that her baby is sick and there's nothing that can be done. Every other challenge is small by comparison to that. And if we keep that mum and that baby who really needs the support that they need at the centre of all we do, then that will mean we're headed in the right direction with a child-centred approach. The challenges are huge. They come down to capacity, capability, equipment, commodities, and we're here to walk alongside our Timorese colleagues as we overcome those together.
Beyond delivering immediate surgeries, how is this partnership helping build local capacity?
Local capacity is absolutely critical in everything we do. So it happens informally by a surgeon standing next to a surgeon, each with a scalpel in hand working together, an anaesthetist and a international anaesthetist and a local anaesthetist studying complex cases, because surgery is an apprenticeship, we need to remember. So you can't just learn it from a book, you have to learn it by doing. But we also do formal training.
For Timorese families watching who may have a child struggling with surgical issues, what message do you want to share with them?
Well, most importantly, my heart goes out to them. But please know we have a long-term commitment to Timor. You have extraordinary surgeons here, and we're working really hard to be able to support them to meet your needs going forward. In the meantime, please come to one of our clinics. We hope to be here this time next year. And I also have a request: if there's any families with healthy children, with business and so forth, one of our biggest challenges is always fundraising to make sure we can continue this going forward to support those families. And I would very much appreciate if they headed to our website, childrenfirstfoundation.org.au, to see more information about this.
Thank you for talking with RTTL World News Manager Sika.
Oh, thank you so much. I'm very grateful.